The contrast foot bath is a powerful treatment that does not alter the vital signs. So the definition of the contrast foot bath is a series of hot submersion baths contrasted by cold submersion baths to the feet. The leg can also be submerged as high as on the thigh as needed for the condition involved. So, what are the physiological effects of the contrast foot bath? The blood vessels will dilate in the hot foot bath, or they will expand. The blood vessels will constrict or narrow in the cold foot bath. Thereby, circulation is increased without warming the deeper tissues. So, here are the treatment conditions or indications. Poor circulation in the feet, tendinitis in the feet or ankles. So, obviously, the water needs to cover the ankles for this. Derivation of the migraine headache. We can draw blood away from the head to relieve the headache. Ankle sprains, plantar fasciitis, diabetic neuropathy. Now for this, make sure you are under a physician's care when you are treating somebody with diabetic neuropathy. Arthritis, rheumatoid or osteo, gout, and reduced soreness after exercise or excessive work. So, some contraindications or conditions that you would not want to do this for. Hypertension or high blood pressure. Raynaud syndrome. For this, it would be more of a caution. You could use cold water between 70 to 80 degrees Fahrenheit. Lymphedema due to disease. Peripheral vascular disease. Here again, this would be a caution where you would only need 20-degree difference instead of a vast difference of extreme temperature. So let's just make that clear. If you're using water at 101 degrees, the cold would only be 81. So that's your 20-degree difference. Arterial sclerosis, which is hardening of the arteries. You'd want to be under physician's care when treating this condition. And the unconscious person. Here's the equipment that you would need for the contrast foot bath. 2 dish pans or similar containers large enough to immerse the feet to the ankles. Hot water between 101 and 100 degrees Fahrenheit. Cold water between 55 and 70 degrees Fahrenheit. Extra ice for cold bath. Extra hot water to maintain the hot bath. 3 bath towels, a digital thermometer, a time device, Epsom salts or other bath additives could be optional. And prayer is important for these treatments to bring the person into the presence of the divine healer. So here's the procedure of the contrast foot bath. Clear your client for contraindications and take vital signs. Explain the treatment procedure to the client and get their consent to treat. Place 1 towel on the floor where the basins of water will be. Fill 1 basin with hot water at desired temperature. Fill the other basin with the desired cold water temperature. Use the thermometer to get accurate reading. If you are in a remote or primitive area and you don't have access to a thermometer, use your elbow to test the hot water for 5 seconds. And if the water is not burning your elbow, then it is probably safe enough for the client. Assist the recipient or the subject in placing their bare feet in the hot water for 3 to 5 minutes. Switch to the cold bath for 30 seconds. Switch back to the hot bath for 3 minutes. Switch to the cold for 30 seconds. Repeat these steps between the 3 minutes hot and 30 seconds cold at least 3 cycles or longer if need be. The client can move their feet in water to encourage mechanical stimulation if you want more stimulation. After the last 30-second switch, towel dry the feet thoroughly. Dress the feet, retake vital signs, and record the treatment. You want to begin these treatments with prayer because that is really who the healer is the God of heaven.